Hello, this is Ariel Wilson Harris. I am the Communications Director for Metropolitan Human Services District, the local governing entity for mental illness, addiction, and intellectual developmental disabilities. We are here discussing how to get back to the normal, protecting your neighbor, and getting vaccinated. We're discussing this with a few experts in the field, and one of our lovely panelists to join us today is Dr. Kimiyo Williams. Welcome, Dr. Williams.
Thank you so much, Ms. Wilson Harris, for having me. I'm so happy to be here today.
Yes, well, tell us a little bit about yourself and your background, and then we'll get started with a few questions.
Certainly. Again, I'm happy to be here. Thank you for having me. My name is Dr. Kimiyo Harris Williams. I am a board certified pediatrician certified by the American Board of Pediatrics, and I'm a fellow of the American Academy of Pediatrics. I am a native New Orleanian. I enjoy educating my patients and encouraging healthy habits so they can be intentional in their health. I am a graduate of Xavier University for my undergraduate degree, and a graduate of Louisiana State University School of Medicine in New Orleans. I completed my pediatric training at LSU School of Medicine and Children's Hospital of New Orleans. Currently, I am the CEO of KH Williams Enterprises, which is an executive health entity focused on health advocacy, medical practice, and medical consulting. I am a wife, a mother, and a grandmother, and I love advocating for the health of our community.
Awesome, which is why we have you here today. So we're really excited to talk to you about a few things. Knowing the climate that we're in right now, we have so many questions, right? Everybody's anxious about getting back to the new norm and what that looks like. So my first question to you would be, dealing with kids and dealing with children and parents. What is the first thing that you would tell them as far as precautions?
As it relates to
New normal,
as
it relates to COVID-19.
Okay, so the first thing I would tell them as it relates to precautions is the same things, pay attention to wearing masks. I know they're saying not to wear your mask, but you want to make sure that if you're in a larger crowd, you want to wear your mask. One of the key things now is getting vaccinated, and that is very important. Recently, the CDC has authorized approval, the FDA approval for children 12 years or older to be vaccinated. And so that's very important to get vaccinated. Continue to monitor your environment, socially distance as much as possible. If you're not vaccinated, wear your mask if you're not vaccinated. Those are some things that I say to pay attention to. We see a lot now that people are out and about. A lot of people are not wearing masks because they're some fully vaccinated. So pay attention to the guidelines, pay attention to the CDC website, as this is a fluid situation. So we have to stay abreast of the new recommendations and guidelines.
Absolutely. And with those precautions, what would you tell parents regarding, the summer camps coming up? A lot of people are letting their children go around their friends now and traveling and all that. So aside from those precautions, would you still encourage folks to stay within their own quote unquote pods and stay in smaller groups?
So that's a challenging and a very complex question, because really the answer depends on vaccination, right? If you're vaccinated, then you have more opportunity to do things that you haven't done. And
Right.
if you're around others who have been fully vaccinated. But that's the key. We don't know who's fully vaccinated and who's not fully vaccinated. And so there times when you're in larger groups around those who you're not sure if they're fully vaccinated, then you should abide by the guidelines of wearing a mask and socially distancing, because there is, and if you're fully vaccinated, that's good for you. But if those people aren't, it's not good for them. So,
So let's talk about vaccination hesitancy for a second. So some parents do not want to get vaccinated. They don't even want their children to get vaccinated. Vaccines available in their age group. What would you tell those folks? Is there anything? Are there any myths or miseducation out there that are making parents feel like, oh, I don't want my child to take the vaccine, etc.?
yes, so there are a lot of myths and a lot of misinformation as it relates to COVID-19 and the vaccine. So what I like to do is start with what we know. So what do we know? What do we know about the vaccine? We know that studies have shown that the COVID-19 vaccine is effective in keeping you from getting COVID-19. Getting the vaccine can also help you um, avoid getting seriously ill if you do get COVID-19. And after you're fully vaccinated, you can start doing some of the things that you stopped doing because of the pandemic. So those are some things that we know. And also, I find that if parents know more about the vaccine, like how does it actually work? So this
Mhm.
is the mRNA vaccine. So this vaccine teaches our immune system how to recognize and fight the virus that causes COVID-19. It typically takes 2 weeks after vaccination for the body to build up immunity or protection against the virus that causes COVID-19. This means that it's possible that a person could still get COVID-19 before or just after vaccination and then get sick because, the vaccine didn't have enough time to provide protection. And so I like to educate people around the details of how it works. Because sometimes, a lot of times, when people know how something works, they'll be able to make a more educated decision about, moving forward with getting a vaccine.
Yeah, and I think even with that said, there have been some cases reported of people getting reinfected after being fully vaccinated. And that causes some hesitation for folks who haven't gotten vaccinated to discredit the reputation of the vaccine. So, with that being said, I think that wouldn't you say that it should encourage people to even get vaccinated more because it's going to help you with any serious complications, even if you were to get reinfected, right?
Yes, yes, it should. And, with people of color being more disproportionately affected
Mhm.
by COVID-19 because of underlying medical conditions, this vaccine protects you from having those severe complications after being infected with the virus that causes COVID-19. So, that is more of should be more of a incentive for people to become fully vaccinated.
So let's kind of switch gears here to mental illness. So, with the world establishing all these new guidelines and there being anxiety about a lot of different things, in 2020, we experienced a racial and a global pandemic. So, how would you address young adults who are struggling with a mental illness or may be having light symptoms that their parents are now seeing due to the pandemic?
So this is a huge question. This is a challenge for young adults because young adults, their support system is usually their parents or their family members, and those people, their support system, they're under stress because of the pandemic. So you have that going on and the stress that the parents, the caregivers, the family members who normally support those individuals who struggle with mental illness, they're struggling themselves. So I recommend that those young adults who are struggling with mental illness, either, they maybe have a prior diagnosis or new symptoms as
Mhm.
a result, to find a trusted parent, a trusted school counselor, a trusted family member, a trusted family friend. And you notice I'm saying trusted before every one of those persons I suggest, to help assist them in getting professional mental health care. And if that is not, if they can't find someone who is willing to help them, that they go to their pediatrician. Most young adults can go to their pediatrician without the parent, or without the parent being in a room if they're not comfortable, depending on what the situation is. And a lot of times that pediatrician has developed a rapport with the patient, and they feel comfortable talking to their pediatrician, and that pediatrician can act sometimes serve as a third party to actually get the conversation started with the young adult and the parent. And the pediatrician has resources and can refer that young adult to appropriate mental health care provider. So I never want a young adult to take on a mental illness alone, like they don't have anybody or any resources, because that's not a good, there won't be a good outcome there. You have to seek medical help, mental health care provider who can help you and assist you. So always reach out to those trusted adults who can support you and facilitate getting you to the appropriate mental health care provider to help you through these challenges. And I mean, during the pandemic, it's obvious that access to care has been a problem and an issue for so
Mhm.
many reasons. And
Yes.
so, yeah, that's a major issue. And so that pediatrician is kind of that conduit to getting someone plugged into that appropriate mental health care provider.
And that's a good segue into our last question, which is I would like to focus it on those folks living with intellectual and developmental disabilities. So, if you're an adult or if you are a child living with it, they're caretakers. What are some things or what are some resources that they can look for to assist during this time? If those early interactions and those early stages happen during the start of the pandemic? What is some resources or guidance that you would give to them?
So this is huge, and the formative years of life are very important in cognitive and behavioral development in children. So in early childhood, it's critical to establish a foundation of learning and social skills for young children. In those preschool and early childhood ages, the pandemic has caused a huge, you know, divide in intellectual and developmental disabilities, and children usually learn the basic building blocks of speech, language, reading, writing during that time. And so with the pandemic, many were not able to attend daycare. They were had to transition to virtual learning, and so those things impacted their social interaction, and that played a vital role in their development in as far as their behavioral and cognitive skills. So as we look, to the what's the solution, we also have to look at the data and how has this pandemic affected them and will affect them moving forward. And so the impact is, the data is still out. It's not as inconclusive right now because we're just kind of moving into some sort of normalcy, or what you may call normal, but that normal changes daily. So
Right.
we have to continue to do, and probably will be doing longitudinal studies to see how the pandemic has impacted the intellectual and developmental disabilities of children. In the meantime, putting measures in place in the education system to address that,
Mhm.
address these deficiencies that may be a result of the pandemic,
Mhm.
Also, resources like speech therapy, occupational therapy, all of those resources, and it has to be a concerted effort. We have to work together, the educational community, the rehab community, like physical therapy, occupational therapy, speech therapy. All of those entities have to work together. And so the key resource will be, I will go back to your pediatrician, I will go back to your counselors, go back to your educational system, and you work into how those deficiencies may impact their mental health and their
Yeah.
mental health being. And because, you know, if you're feeling that you are deficient in areas as a child, that affects your mental health. And so all of those entities work together. So it really, um, the school system, the educational system is probably the system that recognizes a lot of these deficiencies. And so I think that is the building block there to start with resources in the educational system, in the medical system, as far as their pediatrician. And if the parents think that they're seeing deficiencies or they're seeing issues, is paramount that the parent be an advocate for their child.
Absolutely.
And
Yes.
don't take, oh, it's okay, it will, get better. No, advocate for your child. Go into that pediatrician's office, go into that principal's office and say, my child is having an issue in this area, and we need to find some resources to help. And I think that's where we start.
Dr. Williams, that was a wonderful way to end this. That was so, so knowledgeable. And we thank you so much for your time and your passion around this. And the community needs to see people who care, but also people of color, because this is obviously a disproportionately affected type of pandemic that we're dealing with. So, with that said, you can also go to mhsdla.org for more resources. We are here for the community as well, and we're here to keep the conversation going. So again, this is Ariel Wilson Harris, Communications Director for MHSD, and we want you to protect your neighbor and get vaccinated today. For more information, visit our website, mhsdla.org. Thank you.
Thank you.
Bye-bye.
Bye.